You're going to do it because something is not working in your life because you want to change something. And that's what we always want to be focused on. Could I run a marathon, half marathon the first day? No. Could I when I gradually built up to it? Yes. And it's absolutely the same with exposure and response prevention treatment. We're going to take back your life because that's what we're going to do. We're going to take back your life from OCD, empowering them that this is your decision. I'm here as your guide, but you're ultimately the boss of this treatment is important. Scary and tough as a parent as your kids get older and they start to maybe still look to you for that guidance and you can't necessarily protect them from everything. Do it scared. You're never going to be at a point where you're like, this feels easy, but it's absolutely worth it.
Hi, everyone. I'm so glad to welcome today Misti Norton, who's an OCD specialist down in Alabama, right?
That's right. Yeah, Birmingham, Alabama.
In your private practice there.
Yes, private practice. We're actually fairly new. We're a baby private practice that opened 10 months ago.
Oh my goodness, you're coming up on a year anniversary then.
Oh yes, we're going to celebrate big for our anniversary. So excited about that.
But every milestone is important.
It is.
I love that. So I just want to give a quick, story time because we are part of a similar Facebook group, like a private practice Facebook group. And you had posted about an OCD group for teens.
Mm-hmm.
And at that point, I saw it and I was like, I need to stalk you. I need to connect with you. I want you on this show. For those of you who are new listeners, Teens Uncharted is all about treatment with teens, talking about the provider perspective, the parent perspective, teens, etc. And so I was so excited to chat with you because I know that OCD treatment in teens is more of a niche treatment.
Absolutely. Yes. In fact, I see a lot of people who have been in general therapy and have had some good benefits and good relationships, but are really looking for that specialized OCD treatment that they have not been able to get elsewhere.
Okay. So that was actually one of my first questions for you because I feel like when you see kind of like a generalist therapist or you see someone who kind of specializes in the population, but maybe not particularly in OCD or treatments that would be effective, there's kind of this question about like, when do you seek specialized treatment like OCD or ERP versus when do you kind of continue down the threshold that you're on and seeing someone who's more of a generalist?
Yeah, that's a great question. And a big piece is just what are you looking for as the client? I've had several parents reach out to me wanting specialized OCD treatment for their teens, wanting them to do exposure and response prevention therapy. And unfortunately, in some cases, the teens just weren't quite ready for that and wanted to stick with general therapy and coping skills. And even though I'd love to see them and I'm always so excited to help people, I know it really wouldn't be beneficial and I would really be a poor steward of the parents' time and money if I'm trying to see them and they're not ready to really commit to this specialized treatment. I've had plenty of people that reach out to me for a consult call and then I'd say, okay, I'll get back with you. And months go by and I think they're not going to get back with me. And then suddenly they do. They've reached that point where they're ready for specialized treatment. But we very much focus on what we call measurement-based care, and that's checking in each week on how you're doing in therapy. Are you benefiting? Are you meeting the goals you set? Because if you are, then great. We want to continue on that track. And if you're not, we want to evaluate. And I think that's where people decide to come to us for specialized treatment. They are not maybe meeting the goals that they want to meet. And ideally, a lot of times other therapists refer to me. They say, this person, we've had a good relationship. I'm not an OCD specialist, and that's what they need right now.
So, and that's interesting because I do feel like when we're talking generalized therapy, the prep that goes into getting maybe initially into that like first therapist office to just like sit and talk, right, is a lot less prep than it would take maybe to start ERP and to see the benefit of it.
Absolutely. Mm-hmm.
Right.
Yeah. And I think, yeah. So I think a big piece that we always don't want to shortcut with ERP is really, first of all, saying, what are you hoping to get out of this? What are your goals? Because I tell people you're not going to do difficult exposures and prevent your responses because I think it's a good idea, or because your parents think it's a good idea, or because your teachers think it's a good idea. You're going to do it because something is not working in your life, because you want to change something. And that's what we always want to be focused on is, what are you hoping to get out of this? What's not working in your life? And how can I help make that change? And I think when we really keep that central, people are able to power through some really difficult pieces of therapy because that's true. They are able to see that I'm trying to go in this new direction, and that takes work and it's hard. Mm-hmm. The other thing is we very much focus on an exposure hierarchy in ERP. So
Yep.
We put together a list of the things that they're avoiding or the things that they're needing to do a compulsion or ritual to cope with. And then we put those in order. We rank each one based on how distressing it sounds. And we're starting on the lower to middle end of that list. We're not starting with the hardest thing. And most people, as we talk, they're like, yeah, that would be a little challenging, but yeah, okay, I'll do that this next week. And then in some cases, they're like, oh, no, no way am I going to be doing that. But then, a few weeks in, suddenly they are. It's kind of like I, in the pandemic, to cope with stress, took up running and was going to just do couch to 5K. But then I fell in love with distance running. I've done some half marathons. And, could I run a marathon, half marathon the first day? No. Could I when I gradually built up to it? Yes. And it's absolutely the same with exposure and response prevention treatment. But yeah, I think those are the key ingredients is let's always stay focused on why you're here, what you're hoping to get out of this, and why we're asking you to do it, that it's not because I'm a mean person and want to put you into difficult things. It's
Totally, totally.
because this is the what we know will help you.
Well, and so talk to me about that because I feel like in therapy, and I get this a lot, right? When we're working on hard stuff, especially in the trauma components, a lot of people are like, I thought therapy was supposed to make me feel better, right?
Mm-hmm.
And when you're doing the exposure response treatment, right, and you're doing your scaffolding, I know that there is like such discomfort that comes with that. So how do you kind of talk with them about how like in therapy, specifically with ERP, you're not going to leave feeling maybe like all roses and just amazing, right? And it's going to take time to like build on that and to work through it.
Absolutely. So I love metaphors, and I think they are so helpful in things like OCD treatment. So, one thing to think about, we compare a lot to physical therapy. So, it's not necessarily going to feel good. I've been to physical therapy, and it was honestly pretty tough each time. But it was what needed to happen in order to get better and move forward. A lot of my teens, especially that are athletes, have done different athletic programs, physical fitness, conditioning. So that can be a great analogy that, to be making progress, you really want to hit that level of I'm uncomfortable, but I can do this and I'm getting stronger versus this is too much and I can't handle this and I need to stop. So, but you also don't want to be doing something that's super easy and not even a challenge because a lot of times parents will say, oh, they're worried about talking to you. They're anxious about this. I'm like, hey, if they weren't, they probably wouldn't need to talk to me because this is tough
Sure.
to do.
Yeah, yeah. So, question for you, as kind of an ERP specialist, is there ever a benefit in, seeing like a generalist therapist maybe to kind of build some of those skills and then converting to ERP? Or do you see kind of half and half, like half kind of coming from maybe a generalist space where they've been recommended for intensive treatment, and then the other half that kind of just jump into it because they know that that is a thing for them and they want to work through it?
Yeah, it really does seem to be about a half and half split. I have some people that get referred from another therapist. I am listed on the International OCD Foundation's list of providers, and I have a few people that I think have just decided I'm ready, and so they end up searching, look on that website, and find me. There aren't a lot of us in Alabama, unfortunately. So since we opened the private practice, quite a few people have said to me, "Oh, I'm so glad I found you because I hadn't been able to find anyone here." And then fortunately, I do have what's called PsyPact, which is where psychologists are able to see clients in other states. So at this point, there are 42 states where I can see clients by telehealth. And so that works out really well because it helps us meet a lot of other underserved areas as well. But yeah, either way, I think sometimes people get referred and maybe usually still they've been talking with their therapist, sometimes their psychiatrist, and saying, hey, we've dialed in your meds, we've done good general therapy. There's really nothing else. We're going to be stuck unless you're able to move into exposure and response prevention. This is what's going to help you the most. And then quite a few people seem to Google OCD therapist or Google OCD treatments, and then luckily are able to learn about it and learn about what needs to happen. And so they find me that way. And that's been really great too.
Okay. Okay. I love that. I think you hit the nail on the head when you talked about kind of disadvantaged communities and like rural communities and spaces that maybe
Mm-hmm.
don't have those OCD treatments. And I went through the ERP training and I work with OCD, but not necessarily as a specialty. And I completely understand like the level of pain that people are in when they're
Absolutely.
right when they're experiencing like really strong like OCD symptoms. And I'm kind of curious from your perspective. when we're talking about teens specifically, right? A lot of times we
Mhm.
come in and we have teens that are going through hormonal changes. We have teens that are going through relationship issues. We have teens that are going through like, I hate my parents and I want to move out and I want to disown them, right? We have all this range of stuff. So how do you decide, kind of like how and when to do treatment in relation to different like diagnoses, right? So if you have someone who's, an OCD diagnosis, but
Mhm.
maybe they also have a mood disorder or they have like borderline, which I know people love to throw around for
Oh,
teenagers.
sure.
How do you decide when and how ERP can really kind of fit into their profile and into their treatment?
Oh, yeah. I'm so glad you asked because that is really one of my favorite topics.
I love
So,
that.
yeah, shared decision making is the term we use and what we focus on. And what that really means is we want to, again, think about what are their goals, what's most important to them. Sometimes I'll say, what do you most want to get out of this? What do you most want to change? Sometimes it's like, oh, I just feel so down all the time. I stay in bed all the time and I can't get going. I have a few people because I also specialize in sleep disorder treatment. So I have some people that are like, the real problem here is I can't sleep. And then for many, they're saying, well, the problem here is that I feel I can't get out the door in the morning because I'm having to do these rituals. It takes me so long to maybe pack my backpack or fix my breakfast because I have to do it just right or something like that. So a big piece is what's bothering you the most. That lets us know where to start. But then we really do want to drill down on what's driving the bus, so to speak, in terms of your symptoms. So, for example, teens unfortunately are a perfect storm for sleep problems. They are
Yeah.
naturally night owls, and that doesn't fit with our school schedules, getting to school in the morning. And they are usually having relationship issues, worries about life, worries about school, future planning that may keep them up at night. And then also they've got all these hormone changes. So all of that can make sleep tough. But then I'm thinking specifically, I have several teens right now that when I'm asking, what do you want to change, they say their sleep. But the real problem is that their OCD related compulsions are taking a lot of time at night and are preventing them from sleep. So as we think about how do we treatment plan rather than starting with CBT for insomnia or something like that, it really did make sense to start with the exposure and response prevention, because if we can teach them to face those fears and then stop those compulsions at night, they're probably going to be able to get to sleep because their body wants to sleep. It's just that they're needing to maybe do their homework over and over. I have people that are trying repeatedly to write an essay and they have to do it 5 times to get it just right, or they have to count things a certain way. They have to say prayers maybe a certain way before bed. And all of those things take time, unfortunately. And so that can interfere with sleep. So that's usually my big question is what's driving the bus? And then a big thing also is just what are you willing to do? I have some people that are like, I know I probably need to do exposure and response prevention. I'm just not ready. And so unfortunately, what we don't want to do is simply talk endlessly about symptoms because that can actually make OCD worse. OCD loves to just talk about your symptoms and compulsions. So we don't want to do that. So I might want to, if sleep is a problem, for example, I might want to focus on that instead. So they're getting a good evidence based treatment for something that they're concerned about. And then that's going to help them. And it's also probably going to help them feel motivated to engage in exposure and response prevention because they've seen that, okay, this woman, she does know what she's talking about and I can do hard things. So all of those things really combine to move them in that direction.
Yeah, no, and that makes so much sense. And I think you brought up like kind of two really good points, right? Like one thing you had said before is that a teen, right, which in their
Mm-hmm.
brain at that point in time will say, "Oh, it's sleep is the issue," right?
Yes.
Then
Mm-hmm.
you actually had said that it's not actually about sleep, it's about what kind of happens before that. And so it sounds like in your work, you do a lot of stuff about like uncovering kind of like what's actually happening, right? And I think
Exactly.
that most teens who are in treatment they want to get treatment, right? They want to like engage in that support, but whether it's like their own, like vision or their own kind of like this is what's happening, right? They've created a narrative. It's like
Mm-hmm.
so important for us to take a step back as providers and be like, wait a minute, like you're saying sleep, but tell me more about that.
Exactly. So important to know exactly what is causing this.
Yeah. And I do think that oftentimes, like, I make a joke with my teens always, and I'm just like, don't come to the chiropractor and tell me that like your back hurts when really it's like your big toe, right?
Exactly.
Because I can't do much about your big toe if I don't know about it. Um,
Mm-hmm.
so a lot of I feel like work with teens, right? When we talk about characteristics of providers, is like taking the time to really understand what's happening. And that might mean that you're like, back and forth and doing a lot of different like exploratory stuff to like really understand the problem.
Exactly. Yes, we are really drilling down, like, take me exactly through what's happening in the evening, what's going on in your mind, what's going on in your body, and step by step, what are you doing? Because that's going to tell us so much about how we need to address this issue,
Yeah,
or
totally.
usually these issues, multiple issues, most of the time.
Yeah. Yeah. And the other point you had brought up is kind of this like willingness, right? And talking about like being willful in treatment and being willing in treatment. And I'm kind of curious how you see that for teens and then how you see kind of resistance paired with all of those.
Absolutely. So, and I've seen this in adults too, but especially it comes up in teens just because usually if adults are coming to treatment, they've decided to. Sometimes for teens, it's a little different because their parents are the ones who have found me and reached out to me. And they're often really excited to work with me, but then their teen is not quite willing to change. And that's what we ultimately come down to is that I wish I had a magic wand. I don't. I have a wonderful program that can guide you through getting better. We know that about 75% of people with OCD are going to have substantial improvement with ERP, and we know that they're going to have about a 60% reduction in symptoms. So they may still pop up at some point, but this is going to be a much more manageable level. And I love saying we're going to take back your life because that's what we're going to do. We're going to take back your life from OCD. We're going to shrink OCD. So maybe it's a really small part of your life over here, but it's not running everything like it is right now. But sometimes teens just aren't willing to do that. Maybe they don't yet have the insight that it's something they can change or need to change. They think that maybe parents need to change, or if the world will just accommodate them, then it will be okay. And at some point, they usually will realize, hey, no, I'm going to have to make some changes, but we can't force it. Sometimes they're just not there, and that's okay. I talk a lot with people about what does it mean to be ready. If it means that, yes, you have a major change in school next month, or you have some major activity coming up, you're having surgery, your family's moving, all kinds of different things. Sometimes maybe there legitimately will be a better time. You truly need to get through this upcoming major change. I always say though, if it's just that you don't feel ready or this feels difficult, well, you're never really going to feel ready and like this is going to be easy because you wouldn't need treatment if it was going to be easy, but it's worth it. But they've got to get to that point. Yeah.
Yeah, that's like that quote. And I don't remember where it's coming from, but it's like the do it scared, right?
Yes. Mm-hmm.
Do it, whatever. It's kind of like just do it. And I think that that is definitely a piece. With every teen is I think there's an anxiety around going into treatment and anxiety about being seen and anxiety about sharing kind of like these like deeper things that are happening. And it definitely sounds like you've created a space for folks where like they know that they can share those things and that you're not going to be like really harsh or rigid or forcing
Yeah.
going at a rate that they can't, right? Because that would be counterintuitive to ERP.
It totally would. And I absolutely emphasize that you're always driving the bus here, that I am going to guide you through this program. We're going to work towards your goals. We're going to work on what you need to do. And I'm going to tell you honestly, if you don't do this, you're not going to see substantial results and changes. But ultimately, it's up to you. I'm not going to be forcing you to do anything. You're always making the decision to do this. And honestly, I think, this kind of reminds me again of when I made the decision to train for a half marathon in an Alabama summer. I was
Oh
training for a
no.
fall race, but that meant training all summer. It was ridiculous. And there was one day I thought, I do not want to get out and do an 8 mile run in this heat and humidity. I just don't. And then I was thinking to myself, but you know what? This is my goal. Literally, no one besides me cares if I don't do it. And somehow simply shifting that mindset that this is my choice, I can do it or not, inspired me to go ahead and go do it. And I think yeah, it could be tough because teens are very much trying to develop their own agency. They're trying to make their own decisions, and they can to a large degree, but they still can't in certain circumstances. So I think really empowering them that this is your decision. I'm here as your guide, but you're ultimately the boss of this treatment is important.
Yeah, they have the autonomy to step into that and choose whether or not they want to do it.
Absolutely. One thing I'm really excited about is I'm going to be doing a training for SPACE this summer, which is a supportive parenting for anxious childhood emotions. And I'm
Yeah.
excited to do that because I was realizing, if you're the parent, you try really hard to set things up for your kids, but in the end, they do have to make their own decisions and you can't force change. What you can do is decide how you will handle things and what accommodations you may personally be willing to do as a family. And I'm really excited about space because that means I'll be able to offer some help to these parents who are looking for it, but their teens just aren't quite ready to engage in therapy with me. But the parents are now going to get some skills that will really help them to know how they're going to handle their child's OCD, because they are in charge of that. They can make decisions about what they will and will not accommodate, but they can't ultimately force treatment.
Yes, you bring up such an important point because I feel like working with teens, and I work with high risk teens, right? Like they're my people, right? And I say this a lot, even when you have a kid who's kind of actively self harming, right? Because
Mhm.
at the end of the day, you have to get the kid on board with like
Absolutely.
kind of like working through that behavior. Because like I laugh when some people are like, well, we cleaned out their room and we took away everything they could harm themselves with, and I'm just like, you think you did, and you think you got everything, and you
There is always something.
right? There's literally always something. And I have some of the most creative kids that will show me, like, oh, no, I did it with this instead because they took all my like safe stuff away. Right.
Mhm.
And so I do think that there is kind of a lack of support for parents working with like their teens and trying to support them. And like they're trying to do the best they can. Right. Like they're not therapists.
Absolutely. Yeah.
And no one is necessarily trained and prepped and ready for that kind of stage of development, maybe any stage of development with kids, because it's always like it's coming at you like fast and furious. But
Oh, yes.
I think being able to identify the fact that teens don't live in a vacuum, right? That they are like
Exactly.
connected to this bigger thing, and that the people that are there to support them are their parents, right?
Exactly.
Offer a supportive thing to be like, hey, we got you, right, on working through anxiety and how do you sit with it. And I think one of the hardest things, and I talk about this a lot with parents, is like watching your kid fail and watching them struggle and not being able to like do the thing for them.
Oh, it's so hard. Yeah, it's interesting because on one hand, my kids are 10, so I'm coming up on the teen years pretty soon.
Yeah.
But on one hand, it's so great that they're getting more independent, and it's real milestones when they can stay home briefly for a while by themselves, where they have group chats with their friends and I'm not even involved. That's all great. But their needs were substantial, but really simple. I think when they were very small, I pretty much could handle everything they needed. In fact, they were asking me to tell some stories recently about when they were young, and I was remembering how my son, when he was about 2, would ask us to turn on the lights so a tiger wouldn't bother him. I have no idea why he thought that. He's never had not seen a tiger, and we don't live near a zoo. But one thing that struck me is that at the time he truly believed that me being there and turning on the light would protect him from this tiger. And I think it gets scary and tough as a parent as your kids get older and they start to maybe still look to you for that guidance, and you can't necessarily protect them from everything.
Yeah. Yeah. No, totally. And it's just so I think that's one of probably the most challenging pieces of like parenting is like watching your kid, like going through these different things and knowing that like you can't fix everything.
Absolutely. I have much more sympathy for my own parents now. Looking back, I'm like, man, that must have been really hard to watch me make
Right.
this terrible decision. And yet, they did, and we all have to do it. So I think that's so important to empower parents to here are the boundaries you can set. Here's what you can do. But in the end, there is going to be some discomfort for everyone involved because honestly, for your child to decide they're going to do exposure and response prevention with me, they are probably going to have to reach a point where they're like, my life is uncomfortable enough that I'm not willing to live like this anymore. And unfortunately, that often does mean they have some trouble at school. They miss out on some activities they wanted to do. I've had several teens tell me that dating is something they'd like to do and they're struggling with it because of their OCD. So usually people have to get to a point where their life is not working, and that's why they're willing to now make some changes. And that can be really hard to watch as a parent.
Yeah, yeah. So I know when I was going through my OCD training, they talked a lot about kind of like family history in regards to OCD.
Oh, yeah.
I'm
Mm-hmm.
kind of curious, like when you're working with teens, right? What do you see family history wise with like their parents, grandparents? Like, how do you kind of see that, like, I guess, get passed down to the teen?
Absolutely. It's interesting because I've had several parents tell me I realized in my 30s or 40s that I had always had OCD and I did get treatment and I'm better now. And I don't want it to be like that for my teen where they struggle for decades like I did. And then I have some where the parents have never gotten treatment, but they're like, now that you're explaining this, I actually realized that I have always struggled with this, or now I know that my mom always had these problems as I was growing up. So definitely a huge inherited component for OCD, but also in some cases we won't see OCD, but we'll see other anxiety disorders. We'll see depression. We'll see different things like that. So certainly it's not uncommon at all to see a family history. And definitely some family patterns where maybe everybody was doing certain compulsions and things like that, and then are now realizing this is problematic. Sometimes the teens will tell me they're not spending that much time on their compulsions, and part of the reason for that is because their family is doing so much accommodation for them. I'll have family members say, "Oh, I'm making a lot of decisions for them because it's too much for them," or "I specifically I get all their clothes each night and launder them according to the standards they want," or things like that. So a lot of family accommodation is happening. And in fact, some parents seek me out because they're like, "Oh, they're going to be going to college in a year or two, and I'm not going to be there, and I don't know how they're going to handle this." And they're right to be proactive and stepping up at that time.
Yeah, yeah, of course. And in thinking about I guess in some ways like transitions right to college and beyond, and when someone has like finished treatment, right? Like when we're talking about success in treatment, like what do you consider to be success in treatment for teens?
Yeah, absolutely. So generally, we consider that they are no longer performing compulsions and that they are able to simply notice some of the obsessions, the thoughts that come up, and not really engage with them. And I also talk about that OCD tends to latch on to what's important to us, and that may change over the course of our life. So this may pop up for you again. You may need to come back either with me or with someone else for booster sessions in treatment. In fact, I'm working with a 20 something client now who did ERP about 10 years ago with another therapist in another state. And I'm so thankful for the great work that she did to really set us up for success now. So I try to provide good care now, but also provide a good foundation in case this is needed in the future. We know that OCD often comes up. If people have struggled with it previously, it may come up in the perinatal postpartum period. And that's true for men and women, actually, with as new parents. And so I'll let people know, hey, as you go through life transitions, you may need some treatment again, but also these skills you've learned, you can do them anytime. We
Mhm.
actually, in fact, I have this book that I use called OCD is Not the Boss of Me. It's technically for children and teens, and I assure my older teens, hey, please don't think this is juvenile because I use it with my adults too. I just like the handouts better. But really, talking about OCD may try to boss you, but you can always boss back, and that you were ultimately in charge. So when this obsession comes up that, oh no, these germs could be going to make me and my whole family sick, I'd better just go wash my hands one more time, that you're going to say, no, no, I'm not going to do that. And then you can always do that, whatever compulsion comes up, whatever obsessions come up for you in the future.
Yeah. Which is just such an interesting, I guess, parallel, right? Because when I work with my kind of like high risk, like self-harm teens, I always try to talk to them about how like treatment is not about getting rid of self-harm, right?
Exactly.
It's
Mm-hmm.
about being able to manage it, being able to understand what's happening, being able to resolve it faster. And like it's also about being able to pick yourself up off the floor if you do get involved in that again in a faster way, right? So instead of going through a year of like self-harm again, you're like, you self-harm once or twice and you're like, oh shit, I need to like get my stuff together and like go back to like basics with these things. Right.
Exactly.
It doesn't mean that treatment before was ineffective. It just means that you're like, going through a skill deficit, or like you need to work on certain things, you've kind of like let it go, or there's just huge life transitions happening.
Totally. And one thing we focus a ton on in OCD treatment, and I'm sure you do with high risk teens as well, is that we don't need to be afraid of negative emotions. We don't need to be afraid of fear. In fact, I joke a lot that, hey, Franklin Delano Roosevelt really had it right when he said the only thing we have to fear is fear itself, that fear is going to be there. And we are, like you say, we're going to do it scared. That it's okay if you have a bad day. It's okay if you feel anxious while you do this. But the bottom line is ultimately you can do it. And every now and then, OCD might win. You might do the compulsions you didn't plan to do, and that's okay. We just want to get back on track the next day, next time.
Yeah. Yeah. So instead of letting it kind of like take over again, right? Like
Yeah,
being the boss, it's being able to be like, nope, like we're not doing this again, right? And putting it back where it needs to be.
exactly. I have a couple of people that really conceptualize their OCD as like a toddler having a tantrum or something. Like it's going to be yelling, but we're just going to leave it over there in the corner doing that and say, okay, I'm going to walk away. I'm going to go on with my day now. And that's okay. I also, I guess, given the current climate, especially, I talked with a client recently who we talked about thinking about OCD as someone that posts lots of inaccurate rants on Facebook, and we're like, we could get on there and really argue with them, but there's no point in that. They're not going to listen. So we're just gonna, and honestly, the best thing, because maybe that's what they want, is for someone to get on and argue with them, and they feel like they've triggered someone. So we're just not going to do that. And it's the same with our OCD. When it tries to tell us things that aren't helpful and accurate, it tries to yell at us that, hey, you need to be doing this. You need to go over and over this route you took earlier to make sure you didn't accidentally harm anyone on your way. We're going to say, okay, whatever, and just go on with our day.
Yes. That's such a great visual too.
Yeah. Yeah. It's helpful with not responding on Facebook, and it's helpful with OCD. Absolutely.
Yeah, no, totally. So you had mentioned the space thing, right? Which I'm so excited for you to go through because it sounds like to me fantastic. But I'm kind of curious, like if we back up to like beginning career for you, how did you get into like treatment with OCD and teens? Because those are like two niche markets.
Absolutely. It is really interesting how that involves. In fact, in graduate school, I focused a lot on geropsychology, so opposite end of the age range. And I still do occasionally see some older adults, but not nearly as many. A lot of my focus now is teens and young adults. And I think I got some experiences, a lot of my early training in grad school, and then on my psychology internship. Some rotations I did are largely who comes through the door, what's needed. And one thing we found is there was a lot of need for OCD treatment. And I found I really, really love it. It's a good fit. So I found that it was something I love to do. And then one thing I found particularly in private practice is that it's important to do what you love, but also what you love needs to be something people want and need. You need to think about what's going to be important. And, one thing I've found is that OCD treatment is something I'm well trained in, know how to do, and I'm continuing to do trainings all the time just because I feel like I can always learn more.
Yeah.
But it's very much needed. In fact, a couple of colleagues and I are working on starting an Alabama affiliate of the International OCD Foundation. There are lots of states that have them. In fact, I learned that Massachusetts, where you are, and Boston has to be the very first one to hold their OCD walk every spring, and all other affiliates can have it after Boston has theirs in May. But we know that we're very excited to do that because we know that's a resource people need, that people are missing it here. And so that's going to be helpful for us to offer that and to be able to provide some resources and help for people and support for people. Because I've had several people that when they complete my symptom questionnaires for OCD, they'll say, oh, I didn't know that other people thought there were good numbers and bad numbers, or I didn't know other
Yeah.
people dealt with that. And that's part of why I'm putting together a group. I deal with OCD every day. So I'm kind of like, yeah, I know people deal with this. But what I'm realizing is other people don't. They're feeling extremely isolated. And maybe their family, friends are like, yeah, just snap out of it. Just stop doing that. And if they would, they certainly could.
Just stop. That's my favorite. That's got to be my favorite response to most things that people are going through. It's like, oh, just stop worrying. Just stop this. Just stop.
Oh, I
It's
know.
fine.
Yeah.
And it's
Yeah, I
like,
saw something. Yeah, I loved. It was like someone said, I hear choose happiness, as though I was like, saw happiness on the menu and was like, absolutely not. I will take anxiety and depression instead.
it's happiness.
Yeah. So people, if they could change it, they totally would. And I tell people, hey, you would have if you could change it. So you're here because you can't, and I'm here to help you. And I guess, yeah, after trying different things, I found how much I loved it. I also started working with some teens and really loved that. I also, teens get a bad rap, but I find they give me a lot of hope for the future, honestly. The ones I work with, and then my kids for the past several years have had teenage babysitters, and I'm so grateful for them because I know my kids aren't going to come to me with everything. So I'm glad for them to have some mentors and some people to look up to. So I also, I guess, since I've worked with so many adults across the age range, and I've seen people that are like, gee, I wish I could have had this help when it first started when I was 14 or 15. And I'm glad to help people anytime they come in. It's, you don't want to keep living that way, even if you're 90. But hey, if we can stop it in the teen years, how much more of life can people have and enjoy?
Quality life,
Yeah.
right? How much more quality life could people have if they had access to treatment that was, like affirming and acceptable and really kind of like paving the way for them to be able to manage things in the future?
Oh, absolutely. In fact, it was pretty amazing when we did a ribbon cutting for our private practice a few months ago, and most of my extended family came to it. And actually, the Chamber of Commerce was like, "Well, we've never had this much family participation before." And my sister was like, "Well, hey, we have a lot of those things that you have listed as things y'all treat." And I think about that because I do a lot of family history research, and through the generations, I've had plenty of people that did not have access at all to treatment they needed, either because it didn't exist or because they lived in rural Alabama. So even if treatment did exist in a city, they couldn't get there. So I'm so grateful that we do live in a time where people can access evidence-based treatment.
Yeah, no, 1,000%. I agree with you. I love teens for so many reasons. Like they're my obsession, right? We've talked about this, and
Oh yeah.
I couldn't imagine working with like really any other population,
Mhm.
because they're just like my people, and they give me so much hope for the future. And
Absolutely.
in regards to just like their thought process and how kind they are and how they're working through it. And like I think that teens get a bad rap. I think that they are under an immense amount of stress. And I know that there are a lot of people that will say, oh, well, they have it easy. All they have to do is do this. And it's like, okay, when you really think about that, right? Like there's
Mhm.
not a single K through 12 year that I would want to relive. None of it.
Absolutely not.
None of it.
Yes. Pretty
So
much every year I hear, I'm like, I am so grateful I'm done with that.
yes, yes. And it's wild to me. And I understand why parents are like, well, it's so easy for them. They have all these things that are easy for them. And it's like when you think about like access to technology and phone use and the social structure at this point in time, and like literally a lot of the teens at this point in time have lived through so many disasters,
Oh
right?
gosh, so much.
We have lost count. There's all this like political discord that's happening at the same time, right? And then we expect them to still maintain straight A's and work their butts off to what? Get out and work at a full-time job 80 hours a week where they never see their face. Like there's all these pieces that I'm like, I have kids all the time that are like, why would I go to school? Why would I engage in this? Right? Because
Exactly. I think people have to know what are you working toward? Is it something I even want?
exactly. And then at the same time, we have all these reports that they see where people are like, oh, your job is going to be taken by AI, right?
Yeah,
You not have a job. And so a lot of the teens I work with are like, why would I do all these things? Like, why would I jump through all the hoops just to not be able to have a job that I can afford to like feed my family and take care of myself?
exactly. I think, and yeah, I think they don't know what's going to happen with jobs, with education in the future. Climate change is a big concern for a lot of the teens I work with. So they're
Yeah.
like, yeah, why do I need to be so focused on the future when I can focus more on what's happening right now? Because I don't know. I think previous generations maybe had the idea that if I follow these steps, these things will happen for me. And I think we just don't know that they will in a lot of cases.
Yeah. It used to be the case that that would hapen, right?
Yeah,
And now I
exactly.
just think nothing is assured, right? So you got a lot of teens that are in very impactful periods of brain development that are like, if you're not going to assure me, right? It's like the constant thing. It's like if you're not going to assure me this, why would I put in the effort?
Oh, absolutely. And yeah, I think what you said about the access to information, the social structure, it makes such a difference because I was thinking, I mean, there was plenty of discord in the world. My parents, looking back on it, had a lot of stress they were going through that I appreciate now, but I just didn't know about a lot of it when I was a teenager. But with so much more out there on social media, 24-hour news cycle, I think teens know a lot more about what's going on and hear so much more. There were always bad things happening, but we hear and are exposed to so many more of them now that it is understandably harder.
Yeah. Yeah. No, 1,000%. So I was just so glad to connect with you in regards to like teens and OCD and stuff, because I do feel like I love teens. I will never stop advocating for them in treatment and to get access to the things that they actually need, right? And I do think that there is a hesitation sometimes for parents to get their kids into treatment because
Hmm.
if they're in therapy, right, what does that mean? And
Exactly.
to
Hmm.
me, when I have a parent that says that, or they're kind of questioning whether therapy is the right, I'm like, well, what that says is you're willing to take a step outside maybe your own comfort zone and you're willing to engage your kid in something that could be really helpful.
Exactly. That is so important. And I think I praise parents a lot when they make that decision. And I think, when I think about it and I tell them this, I have never regretted consulting an expert. We have had times where we try to make repairs around the house and then we decide, you know what, we should really just call in someone who knows how to do this. And sure enough, they can fix it pretty quickly. A couple of times I've needed to take my children to a medical specialist and I'm like, well, can they tell me more than what my pediatrician is saying, or can they tell me more than what I read online because I'm good at looking things up? But yes, they absolutely always could. And that's what I tell parents that I have devoted my life to this. I know how to help, and you are absolutely right to bring your teen in for someone who can help. I also emphasize that even though I am a psychologist, if my own children need help, it won't be with me. I'll be seeking expert help. And that is absolutely the right decision to make. And I'm so thankful people are doing it. I also, one final thought, I have a little hope little more hope for the future because I went to speak to my children's elementary school classes, and I talked to the third, fourth, and fifth grade classes, and about being a psychologist and what my job involves. And I talked a lot about OCD treatment. I talked a lot about some of the work I do on sleep, and I talked about how my office also offers evaluations for ADHD and autism. My colleagues do some of that work. And, when I was in school, it felt like people very much did not want to admit they went to therapy or they might have
Yeah.
something going on. It was this big secret. And now, I mean, kids were raising their hands like, oh, Dr. Norton, I have ADHD. I had some tests like you're talking about. I take medicine. It really helps. A couple of people were like, oh, yeah, I think my mom has OCD, but she's been going to a doctor and that's been good. And they are just so much more comfortable talking about mental health. And I'm so grateful because I hope that will be a change.
I could just imagine like these little three, four, fifth graders that are just like, just totally open to sharing all that stuff and being like, it's okay. It's okay to need help. It's okay to seek treatment. We would never shame someone for going to a chiropractor. We would never
Never.
shame someone
Yeah,
for getting like medication for a stomach issue, right? We would never shame someone for like engaging in treatment for cancer. But for
exactly.
some reason, when it comes to mental health and well-being, emotional well-being, we're like, you're bad. That's bad.
Yeah. You
Shouldn't
should have been
be.
able to solve this yourself. And yeah, no one's like, gee, why didn't you fix your diabetes on your own? But yeah, with mental
Yeah.
health, there's that idea. And I hope it's changing.
I think it is. And I think we're part of it. I think we're
I
part of
think so.
pushing it. Um,
Absolutely.
so I'm curious. You had talked about space that's upcoming for you.
Hmm.
Where do you kind of see yourself growing into, right? Like there's a new practice, you're almost a year old at this point.
Hmm.
OCD is definitely a thing for you. Space is on the horizon. What else? What do we have to look forward to?
Absolutely. So I really want to offer a variety of treatment options and at different price points because I know that's important too. So
Yep.
I offer individual exposure and response prevention, but I'm also excited for the group. It does a couple of things. We're able to offer groups at a lower price point, so that's a great entry for a lot of people. And then also it does give that benefit that being able to know that others are dealing with this. I very much want to train others, and I'm very excited that our private practice has our first two graduate students who are joining us in May. So they are going to be learning evidence-based treatments for OCD and other disorders, and I'm extremely excited about that because that's going to expand the services we can offer, and it's also going to train up providers for the future so that there will be more access. Because I know I won't be practicing forever, and so a big thing that's really important to me is to spread this out, to train new people, and to train people who are committed to evidence-based practices. So I'm hoping that over time we'll be offering several group options, several different times of day, several different modalities. Telehealth groups have been huge because it really does allow people to join from different places, but sometimes people prefer in person. So I'd love to be able to offer both options, and I'd love to be able to offer several different types of groups. I also had a couple of clients that are improving a lot and nearing the end of their treatment, but they're saying, I would love to have like a once a month drop in support option with other clients or something like that. So I'm hoping we may have something like that available in the future too. So those are my hopes, that more and more people are going to access evidence-based treatment and know about it. And we'll get the word out and get more people better. I think the International OCD Foundation says it can be something like 17 years from symptoms to diagnosis and treatment, and we want to change that.
Yeah, yeah. As an example, I talk about this all the time when I'm talking about teens and relationships because I really
Mm-hmm.
feel like in your teenage years, every relationship you're in is helping build a groundwork, a foundation for future relationships, right?
Exactly.
And so I talk a lot about how as a community, as a village, right? If we can understand that relationship and what's happening, we can call it like it is and we can help support that teen to like make decisions and understand what different flags are and to like really navigate that in just a really healthy way. We have just shaved like 15 years of pain off of their life because they don't
Oh,
have
so much.
go through those again, right? And they already know what potentially an abusive relationship looks like. They already know what manipulation looks like. They know what those things look like, right? So for them,
Exactly.
they're able to really just like make choices based on that. And I feel like that's kind of what you're talking about with OCD treatment is that if we can interrupt that cycle and offer treatment, right? Let's say within 3 or 4 years, right, of symptom onset to like diagnosis and treatment, we've just shaved 12, 13 years off of their life, right?
Oh, it's amazing. Yeah.
Yeah, yeah. And then I imagine at that point that the patterns that they have developed are still in a space where they're maybe potentially more workable than they would be if they had been longstanding 20, 30 years.
Exactly. Yeah, I've worked with older people who maybe have lost jobs, have been divorced, maybe don't have poor relationships with children, and we do what we can, but those things are hard to fix once those patterns have been set. Where you're right, if we can catch them in the teen years, often we're able to prevent some of those things from happening, and that makes everything better.
Oh, I love this. And I love the OCD piece. The ERP is like so necessary. Like I've definitely seen it myself in practice, how helpful it can be. And I mean, do you have any like final thoughts for any like teens or parents or providers that are kind of like contemplating OCD things?
My biggest advice would be that if you're hearing this, or if you've been reading about OCD and thinking this is the help I need, do it scared. You're never going to be at a point where you're like, this feels easy, but it's absolutely worth it. And I encourage people to let's draw a picture in your mind. Let's draw a picture on paper if it helps. Let's envision what your life can look like when we shrink OCD. And this can be you. It's not just a dream. It's out there, and let's get to it.
Do it scared. Yeah. It to me, it's also like the big, people always think the what if, like, what if I fail? What if it gets worse? What if whatever? But we don't ever think about like, what if I am successful, right? Like,
Yes,
if
so much.
it does work, right? What if I get my life back?
Yes. What if there are things I can do next year? These things, well, I'd love to do this, but there's no way. You can. It can be happening this time next year. In fact, one of my favorites is I can think of one client who maybe, and this was actually an older adult, but he had for years not gone to family Christmas gatherings because it was too hard and there was too much anxiety and stress that went along with it. And after treatment, I mean, he started seeing me in October, and he, like, for the first time in 40 years, went to Christmas with his family in December. So that's huge. And they were so glad to see him. And he was able to start mending those fences, building bridges again. And that's amazing. But also, what if treatment had been available 40 years prior? We wouldn't have even lost those 40 years.
I just think about like, I'm so grateful he was able to go, but also think about the fact of like, you know, what that 40 years could have looked like, right?
Exactly.
If
Exactly.
OCD had been acceptable. So, and I
Yeah.
think my big things is that, everyone is finding a path through therapy. And I don't think there's ever a bad time to start any sort of services. And I do think that if you're having questions, if there's, like maybe this is a thing for me, right? Like get into any type of therapy, right? Like
Exactly.
find a provider that you feel really comfortable with and just start. You'll be amazed at sometimes where you get to, but I think at the end of the day, like there are providers like you that exist that treat this really specific, awesome thing, not awesome, in an awesome way, right? And
Exactly.
we
Yeah.
help people like live life. So
Totally. And I think, yeah, it's so important for, I guess my advice to providers would be you're not a bad provider if you haven't been able to fix this. There are plenty of things I can't fix. In fact, I have a client right now whose OCD is substantially improved, but she really does need some help with borderline personality disorder. And my business partner is an expert in that. So I think she's going to be seeing her. And there are plenty of other things I don't do. For example, I do a little work with substance abuse, but if that's a major issue for someone, I'm going to need to refer to a colleague, and that's okay. I think no one can do everything well, and so being able to have that network to be able to send people if they need something I can't provide means I'm a better therapist, not a worse one.
well, because you have the ability to reflect on like who you work really well with and who you see changes in and who's like not a good fit for you.
Exactly, exactly.
So I love that. We're the same, just bread and butter. Because I'm very similar. If it's something that I really don't feel like I can work with, I'm not the person for you.
Exactly.
I don't want to waste, and I think this is with the OCD ERP thing too, is I don't want to waste someone's time. So if I know that
Absolutely.
there could be something that could be really effective for them, I would rather they get to that than sit with me for, let's say, 6 months to a year and be like, I'm not making any progress.
Totally. That is so frustrating for both the client and the therapist. And it really is, I want to be a good steward of their time and their money. And I want to be really honest if I'm not going to be able to be helpful. But if they're presenting with OCD, I'm like, yes, I absolutely am going to be helpful. So I'm excited to start this journey.
Yeah, no, I love that. Congratulations on an upcoming year and the practice. I know that it's not an easy journey, especially to start kind of like a brick and mortar space. But your presence, your knowledge, like just speaks volumes about people's experiences. So I wish you nothing but the best of luck. And I know we'll post everything down below. So we'll have contact information for how you can get involved and, open up space at some point too. So people can
Yes.
access that.
Absolutely. So yeah, it's been a difficult, challenging year, but an amazing year. In fact, it's given me a lot of empathy for my clients because I've been learning things and pushing myself in ways I haven't done in a long time. But it has been so worth it. And I'm so grateful for it and for everybody who has trusted us with their care and will continue to trust us with their care.
Yes. Oh, I love it. Well, I'm excited about continuing our friendship too and our, kind of legal relationship. And I'm very excited to kind of see what you end up doing. I very much believe that there is a type of therapist out there for everybody and that there's more than enough room for all of us. There's a
Absolutely.
reason people would see me. There's a reason that people would see you. And I think that is a true part of what makes the field so beautiful. So
Absolutely. It totally is. And one wonderful surprise about private practice is getting to meet so many people. And the beauty of technology is that, yes, you and I are many states apart, but I'm looking forward to continuing our friendship as well and our relationship because it's been wonderful. And I've met so many people and I've learned so much. And it's been a wonderful journey so far.
yeah, it's all I feel like just part of the pudding. It's like we're in there and we're, having good conversations and networking and learning so much. And like even today, like I'm trained in OCD, right? But I'm not necessarily like that's not all I do. And so hearing you talk about it, I'm just like, yes, like you get it. And I think it's
Yes,
been an interesting thing for me to find people that have the same maybe level of investment in their practice and teens specifically. And that's been like really wonderful. So
absolutely.
well, I can't thank you enough for coming on the show today and talking about all of this. And like I said, we'll link everything below. So please get in touch if you think that Misty could be helpful. And it's you, your business partner, and two grad students, right?
And two grad students, and we have actually just added a couple of additional psychologists to our practice,
Okay.
and we'll be adding another this summer. And the grad students with me, will be doing OCD work, but we also, some of my colleagues at the practice offer executive functioning coaching for ADHD, autism, and ADHD evals for adults and children. We don't offer therapy for under 14 at this point, but we do offer evaluations, and we now offer couples therapy. And I know, in fact, I've got a few OCD clients and sometimes parents of teens who are like, I may actually need to see Dr. Keys to talk about some couples considerations. So we're excited to have that available, and then wide variety of help for different sleep issues as well and trauma. So excited to help people with a variety of things. And yes, we would love for people to reach out. Several of us are certified through SIPAC, so we can see multiple states.
Which I love. It's the portability, which is so important.
So important. Yeah.
So, all right. Well, I'll link everything. Misty, thank you again for joining us today, and everything will be below.
Thank you so much for having me. This has been fun.